Oh yeah, I have to
Okay.
press continue. Got it.
Okay. So what made you choose to advocate for a plant-based lifestyle in your profession?
Yeah, so I'm primary care. My
Mm-hmm.
job is to prevent chronic conditions as well as manage and treat them and try to reverse them. And so it is my understanding that the best way to prevent and reverse a disease is through lifestyle. If you look at
Mm-hmm.
any disease that is from lifestyle, that's caused through lifestyle, the very first thing in any medical book is going to be lifestyle recommendations. The
Right.
issues that we don't really spend that much time, if any time, on that. We're kind of like,
Mm-hmm.
okay, yeah, of course we're going to do 3 to 6 months of lifestyle
Yeah.
modification, but we're not going to tell you how or how to encourage your patients or what exactly to tell them. You can refer them to a dietitian or nutritionist, let them figure it out. But you just gotta say the line, and then we'll move on to the other 30 things that we need you to focus on in the visit.
Right.
So, um, of course, it's important to understand medications and all the guidelines and what cancer screening things to do from mammograms to colonoscopies. But if your goal is to end up with a healthy patient and all you're doing is screening them for the issues and you're not making sure they don't end up with those issues in the first place, it's
Yeah.
felt really silly. Like a lot of the times I felt like my job could have been done by a computer. Like a computer could say, "Oh, are you 30? You're a 50-year-old male. You are like the questions I was asking were so
Mm-hmm.
easy. Like a computer could
Yeah.
basically my patient, but a computer can't like get down on the level of the patient, understand their lifestyle and their habits, and help them figure out how to actually make changes in their life. And nutrition
Mhm.
obviously is the most powerful thing you can target.
Right.
Like obviously sleep is going to make a big impact, exercises, but nutrition is going to make the biggest possible impact on someone. So it
Right.
was pretty obvious to me. So I will have been practicing 4 years in 2 months, so that's cool.
Mhm.
And I started. I first just wanted to get comfortable because I've only worked in the same clinic that I've been working at, a set of
Mhm.
clinics, and it's very high risk, very sick patients.
Right.
The highest ratings on everything from communicable diseases to prevent like to chronic lifestyle diseases. So like we have tons of HIV and syphilis, and then we also have tons of diabetes and heart disease. So it's everything. So I
Mhm.
took a couple months to just like get that part down.
Right.
Not have it down. You're always learning. But I wanted to at least make sure that I was hitting all of the markers that were necessary just to manage what's going on. And then I immediately figured out how to sneak in nutrition in every single
Right.
conversation because every single person needed that info. They didn't know the questions
Right.
to ask. So yeah, it's if you're a primary care and you don't talk about nutrition, what are you really doing? You're doing the job that basically a computer could do, unfortunately.
Right. Um, so the next question, do you consider yourself an activist? Why or why not?
Um, I don't think it's intentional, but I think I am. I mean, I got a grant through a nonprofit that was specifically about like they weren't just about helping humans live healthier. It's about animal
Right.
protection, environment protection. I think it's really hard to be vegan or plant based and not
Yeah.
become involved in that. Almost because it's like, well, I'm already here. I might as well tell you a reason to join me on this side. Like, not only am I eating something that's healthier for me, but the environment is better off because of it. Animals are better off because of it. So
Right.
it's hard not to. I can't think of
Yeah.
any other position where you're like you just end up looking better. I don't know. I don't know. It's just impossible not to. And I
Right.
don't see a lot of reasons to distance yourself from that. Certainly, there is a line to cross, and if you go really heavy on that and you
Mhm.
really speak about that and speak about it in like a judgmental way, then it can
Right.
actually the opposite effect on people. But in
Yeah.
general, you know what I'm saying. It's
Yeah.
hard to not be pro animals, pro environment, especially when
Yeah.
something is already that.
Yeah. Yeah. I feel like it comes as part of the philosophy.
Right.
Um, yeah. and the lifestyle. Okay. So the next few questions are relating to your current efforts. So the first question, what type of diet do you promote? For example, vegan, vegetarian, whole foods, plant-based, etc.
Yeah, so for all of my patients, I always promote whole food, plant-based. Doesn't
Mm-hmm.
have to be 100% for sure. Plenty of my patients, most of my patients still eat meat or cheese,
Mm-hmm.
but it's as much as you can of it. And I always
Yeah.
talk about the blue zones, and that even with the blue zones, they're 90 to 95% plant-based. So
Mm-hmm.
there's certainly room for like the most optimized diet to have some meat in
Right.
it.
Mm-hmm.
Um, and the intention is for sustainability. So if it's not
Right.
sustainable for you, then there's really no point in doing it, because a week of
Mm-hmm.
something is not really going to make or break anything.
Right.
So whole food, plant-based. I don't even talk about like healthier ways to cook fish or chicken, for example.
Right.
But the understanding is you will find the balance for yourself. But let me show you what an ideal situation looks
Right.
like. You figure out where it's comfortable for you.
Right. Right. I like that aspect that you talked about it being sustainable. Because sometimes people might want to go all in and they find it's too difficult for them and they just quit. So making it sustainable and work for them, I think, is like a really good approach.
Thanks. I agree. Psychology.
Okay. Yeah. So what are your goals for the patients you work with?
Yeah, so I mentioned my primary care clinic. So that's like the bulk of my, I'd say 70% of my like professional life. So for that, so these are patients who come to me for primary care. They come to me basically, they come to me and ask, how can I be as healthy as possible? Can I reverse these things? Can I prevent these things? Can you monitor me for these things? So my goal for these patients is to prevent as many of the most common diseases as possible. So
Right.
preventing diabetes, preventing heart disease, preventing the most common types of cancers. And then I do a nutrition program. So I started it a year ago now. It's going very well. We are expanding it every single month. And so that specific, so aside from the one-on-one 15 minutes that I get, I do every week 1 hour, a different type of class on Zoom. And I do
Right.
classes. They're all about practical information. So it'll be live
Mm-hmm.
classes. It'll be like a stem off a question someone asked. Um,
Mm.
that is targeted for those patients who are like already sick. So
Right.
they're morbidly obese. These are the patients I target. Morbidly obese, so BMI 40 or more. Type 2 diabetic already, hypertension, and then I'm family practice, so I see everyone from newborn babies to older adults. And so
Mm-hmm.
I take kids. They don't have to be super sick already. They just have to be already overweight or have dietary habits, or the
Right.
family dietary habits are predisposing them to that. And then I unfortunately have a couple kids who are already diabetic, an 8-year-old and an 11-year-old most recently. So those parents, I'm like, please come every single time.
Right.
So my goal with the program is to reverse those people who've already crossed the line.
Right.
But then one-on-one is I have material in the clinic that I got from the grant that I can give them to read further. Of course, if they want, they can come to the Zoom classes, but so preventatively, it's like a one-on-one. I just continually touch base. But then I'm focusing my efforts on people who are already sick, who are already high
Right.
risk, trying to reverse them. So,
Right.
prevention, right?
So how do you balance creating content while working as a nurse and consulting patients to make a diet plan?
Yeah. Oh, yeah. So my second, sorry, I said 70%. So the other percent is I do. So I find that weight loss is kind of like sometimes it's like a mixture of vanity and also an actually beneficial thing for your health. Like for
Right.
example, diabetes. Um, people have this misconception that you can develop diabetes because you eat too much sugar. But we know that if you have extra fat on your body, obesity, just
Mhm.
fat as itself, is not just sitting there. It's acting almost like an endocrine organ. It's releasing hormones. It's affecting how we metabolize sugar. And so you could technically become diabetic and never eat a processed sugar if your caloric
Right.
intake is enough that it makes you hold on to extra adipose tissue. It's going to put
Mhm.
you in a diabetic range. So losing weight alone is going to reverse a lot of things going on in your body, a lot of inflammatory conditions, diabetes, and that's diabetes just like one example.
Mhm.
So I one of my private clients, what I do, and you see my Instagram, is I specifically target weight loss. So it's not I'm not looking at their medications. I know what they're taking. I know what their chronic conditions are. And I do have a lot of patients who are like just starting to be diabetic or have high cholesterol or are like, or just started blood pressure medications or on the border, like pre-diabetic. So I have a lot of patients like that. And they understand that although my program is weight loss, they know that losing weight is going to help all of those things. And
Mhm.
so that's the other half of what I do. And there is a little bit of a difference with focusing on weight loss versus just focusing on eating whole food plant based.
Mhm.
You do have to be in a caloric deficit. And so yeah, so that's a little bit more complicated, and there's working one-on-one with clients in a private setting is very different than in the clinic. In the clinic, you got 15
Mhm.
minutes, and you're not as tied to their outcomes as you are when you're working with them one-on-one. When I'm working with
Right.
someone one-on-one, I have 100% success rate. I will make sure that I give you the support that you need to succeed. And so
Mhm.
honestly, it's more time intensive to do one-on-one. But it brings me so much joy because there are way more people than just the people I can see in the clinic that I can help. And
Right.
clients from both coasts. For some reason, no one in the middle of the country. I just have people on the different coasts. So I have New York, Florida, Connecticut, and Californians right now because I'm also from California. And so yeah, so we do. It's not necessarily like 100% a meal plan because sustainability is the goal. So some
Right.
people will work really well from having like
Mhm.
a 3-day meal plan, and then they use that to kind of structure their days generally.
Mhm.
And then some people will benefit just from having like maybe 5 go-to dinners, 5 go-to lunches. That's one of my
Right.
favorite things to do because we
Yeah.
we cook like 30 different things, but really we kind of tend to remember the same like 5 or so meals. So figuring
Right.
out 5 are going to fill you up, that you actually
Mhm.
enjoy and are not going to be processed or you know be against the goal of weight loss,
Right.
really are beneficial. And then there's a lot of like in between stuff like habit
Yeah.
forming. Like there's a lot of us at one point in our lives have issues with nighttime eating. Lately, the stress of the world makes people emotionally eat even more. And when you're
Yeah.
alone at the end of the day, that's like the worst
Mhm.
possible scenario. So that's one of the hardest things to do. And so I'll
Right.
help patients through that. There's some situations of binge eating. There's some situations of
Mhm.
just maybe it's not binge eating, but it's like using food in a really negative way. And
Right.
not really helping you and it's making you sleep worse and it's like this
Mhm.
forever cycle. So how do I balance it? I'm still working on it. I'm trying to, the more one-on-one clients I have, the more kind
Mhm.
of systems I have. But I think for a couple of more months, while I don't have more than 10 one-on-one clients at once, I cannot handle more than
Right.
you're so focused in on them. um, I'm still figuring out systems, and then long term, I'm gonna definitely do groups
Yeah.
because I do have one group, but it's smaller and it's only 1 month. But long
Mhm.
term, I want to do groups because it gives you that support. It's not just me.
Yeah.
You'll be able to talk to everyone else who's going through the same exact thing, um,
Right.
and um, it'll be more affordable for people to do because one-on-one it takes me so much time and have to charge for my time. But in
Right.
a setting, they can get most of the information that I would do one-on-one if I do the length that I do one-on-one.
Yeah.
But but also individualized enough because they can ask questions during the visits. So
Right.
that was a long answer, but I hope that answered it because
Yeah,
I'm
definitely.
still working it out.
Yeah. Um, so what do you think is the most effective way to promote a plant-based diet?
Um, so okay, hold on, let me just make sure I have a call. 2:30. Okay, cool.
Yeah.
The most effective way. So it depends what setting you're in. So do you what kind of setting do you mean? Do you mean in the clinic? Do you mean like someone on the street? What do you mean?
Mm-hmm. How about like in the clinic?
Yeah, so in the clinic, um, I would say so. No one, so saying the word vegan or plant-based may be a deterrent, but if you say, I need you to eat more fruits, vegetables, whole grains, beans, legumes,
Right.
a little bit of nuts and seeds, that's not crazy. So
Mm-hmm.
I start with like the fewest amount of labels as possible.
Right.
Then if they give me a 24-hour diet recall, then I'll kind of pick out, they'll kind of get to it themselves. Like when they're like,
Yeah.
oh, I just make some chicken. I say, well, the chicken has the cholesterol, which you have in your labs, which,
Right.
I would still say you should reduce. And then they're like, you don't want me to eat chicken? Should I have pork? What about this? And then we get to it and I'm like,
Yeah.
well, a leaner, still has protein that will fill you up option is lentils or
Mhm.
legumes or tempeh. And so basically you start as far away from the label as possible.
Right.
Then you make them realize that the label isn't that scary because you just listed all
Yeah.
you're super healthy and then you're
Yeah.
just doing that. So that's definitely how I do it one-on-one. And then in my classes, I started off almost every class reminding people this is why we eat plant-based. These foods have been shown to reduce your risk of disease, be super filling, high nutrients. These foods have high cholesterol, type of
Mhm.
cancer, heart disease, and diabetes. And so we're going to focus on those foods, and we want to minimize those other foods. So I,
Right.
I do
Yeah.
want to right away on the classes, but
Mhm.
I don't I can't like go at the rhythm of each individual person. But
Mhm.
one-on-one, I definitely start out with these are the foods you can eat, and then we kind of figure out which foods that they're already eating that aren't as beneficial to them.
Right. So how has the response been towards your effort at promoting plant-based diets? Have you faced resistance from patients or other healthcare professionals?
Yeah, so definitely other healthcare professionals was my biggest challenge.
Yeah.
Not that they didn't want me to do it, but they believed that no one would be interested. They believed it was too drastic of a diet. I think it's Dr. Esselstyn has like a quote that's all over the place, or it's in either you can have an artery cut out from your thigh that gets sewed into your heart so that you have an artery
Mhm.
that's not cholesterol and plaque filled, that you can die during the surgery of, because all surgeries are life risking, or
Yeah.
just change your diet. So when we
Right.
talk about what's drastic and what's not, although we do have a lot of emotional attachments to food, um,
Right.
changing your diet is much less drastic than undergoing, bariatric surgery
Right.
or open heart surgery, or removing your pancreas.
Right.
I mean your gallbladder. So I would say the to like talking to clinicians, that was kind of where I went at first, and also told them how it wasn't an all or nothing approach. And then with patients, I think I get the point that it's not an all or nothing approach pretty well across pretty well, because I don't have anyone. I don't really have much issues. The numbers have been growing. At first, I had only 4 people. Now I have 20 to 25 people every week, which is a lot for my population that changes their cell phone number very frequently anyway, doesn't have consistent internet. No one has a computer. So I would say
Right.
it's pretty good numbers. Um, so yeah, it's like if they don't want to do a plant-based diet, then they can then they're not going to want to change anything anyway. But if
Right.
you do, there's definitely enough people, and the interest grows every time
Yeah.
I do another cooking class, because it just becomes more realistic. It just they can see what it looks like because maybe they have some kind of predisposition, like just thought about you only eating lettuce and carrots or something, and then you show them like, oh, here's a lentil bolognese, or here's tempeh bacon or this chickpea masala,
Right.
the recipes I've made in the last 24 hours. But here's a couple dishes that look delicious. I promise you would like them. If I could give you a
Yeah.
sample, make them at home. So yeah, I guess the resistance, if there is resistance, I'm sure there's patients who've like come to my class and they're like, whoa, 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 I can't do that. But there's so many, the growth has continued that I know that there's enough people interested that it's making impact, and the impact potential is huge.
Yeah. Do you have any inspirational stories about what you have seen firsthand when a patient transitions to a plant-based diet?
Yeah, so let's see. So my program's only been going on for a year, and then we had to pause it for 4 or 5 months during COVID because I had to
Hmm.
work in one of our nursing homes and really just shake us
Right.
off everything. Let's see, what's the most transformational? So I do have one patient. Okay, so she was like an A1C of 7. So diabetic, not super
Hmm.
uncontrolled, but she is about 140 pounds overweight.
Hmm.
And so this is pretty amazing to me because I don't even, this is not even my patient. This is a colleague of my patient. So she
Right.
only interacts with me via nutrition through Zoom classes.
Hmm.
So she started coming to the classes. She came almost every week for about 2 months. And then I text people to remind them of the class so they can text me back too. And she texted me 2 months in saying, Eugenia, I just want you to know, I know we haven't even seen each other in person in months, but I actually lost 35 pounds just from
Wow.
stuff you're telling me. And
Wow.
it's not like she's not a drastic person.
Yeah.
She's like 53. You know, she, uh, she's not gonna do some crazy diet, and I'm not
Yeah.
doing anything crazy. She's just like,
Hmm.
I just stopped cooking with oil. You showed me like 12 different ways. Now I do it.
Right.
I started including more greens. I'm doing
Wow.
a more 50-50 plate. It's like
Yeah.
she's just taking like a little bit from this class, a little bit from
Yeah.
this class, and she's coming from a culture. A lot of my patients are Dominican, and so they
Right.
put oil in their rice. They have
Hmm.
meat on a plate, cheese, and she's been cooking that way forever. She's a grandma. She's
Right.
like
Yeah.
50, and still with all of the environmental cues to do something different, she's been able to do that
Right.
just from listening.
Yeah.
She didn't even ask any questions. Like she was
Yeah.
sent through that. She also she was gonna get knee replacements. She no
Right.
longer she's delaying that because she has no more
Wow.
pain. The knees are actually really interesting. I forgot the exact numbers, but losing weight on your body, it's like
Right.
4 or 5 times the weight is actually off of your knees. So if you lose like
Hmm.
5 pounds, it's actually like 25 pounds off of your knees.
Wow.
So
Hmm.
you gotta look that up. It's because it's really interesting.
Yeah.
But she was like, I don't need anything about my knees. She's like, I was gonna get knee replacements, whatever. Like my knees were killing me. She still goes to work. Yeah, so it was like massive changes. She hasn't done her labs yet, but I'm sure, obviously, because what we talked about with diabetes and
Yeah.
obesity, um, it's going to be much more better controlled. She may be able to get off the metformin. That's the only thing she's on. So yeah, that story comes to mind because it was just like she's not even my patient, and I didn't even do anything individualized with her. She just listened
Yeah.
to classes in general, slowly taking
Yeah.
notes, and then I'm so happy that she shared it with me because it made my month basically to know
Yeah.
for every
Yeah.
one person that shares, you assume there's lots more who didn't share.
Yeah. Yeah. That's really moving. I really love that story. Um, so where can people reach you if they're interested in learning more about what you do, such as your social media, website, etc.?
Yeah, so I post on Instagram a lot for specifically losing weight, and then I also
Hmm.
interview various clinicians worldwide, actually now, so that's fun, on what they eat in a day. That's what it's
Right.
called. on plant-based diets. So it's just on my handle on Instagram is Nurse Eugenia. My name is spelled Eugenia. So Nurse
Mhm.
Eugenia. And then if you want to look at my website, it's just Nurse Eugenia Nutrition. And the link is on my Instagram too. And obviously anyone can DM me any questions, whether you're thinking about going into nutrition and you're pre-med or you're in
Mhm.
medical school and you realize there's no nutrition education there.
Right.
Or if you're a patient or want to be client and have questions, I love to help. there's enough um, there's enough people in the world that we can quadruple 10 times the number of
Yeah.
working to help people become plant-based, and we will not be out of a job. So I want to help as
Mhm.
much as possible.
Yeah. All right. Sounds good. So that'll conclude our interview. Thank you so much for your time, and sharing all of this good info. You're helping a lot of people by doing what you do, and just know that um, what you do is appreciated, and um, you're you're benefiting a lot of people's life by giving them this information and helping them with their health.
Thanks, Guadalupe.
All right, thank you so much for your time and um, coming in at the uh, short notice of the change time. I
No problem.
really appreciate it, and again, like um, I appreciate you doing the interview with us. It was really great hearing about what you do and your story.
Thank you. Well, good luck. Let me know if you have any questions and when you decide what to do, because you're pre-med, but like you said, you're in nutrition. You
Yeah,
want to nutrition. Uh,
yeah,
there's no nutrition education in school
hmm
yet.
yeah. Okay, thank you so much.
No problem. Have a good rest of your day.
Bye.
Bye.